Family participation in healthcare is a game changer. Hi, it's Dr. Matt Harkness with Allied Physical Therapy Wellness Community, where we believe that health is a journey, not a destination. Something as fundamental as movement should not be complicated. This is why we take what we call a habit-based approach to moving and doing well and enjoying the things that you love each and every day. You don't have to kill yourself in the gym and eat some unrealistic diet to be healthy for a lifetime. It's important that you take what we call a holistic approach to staying healthy and being well. Taking a look at stress management, environment, nutrition, sleep, that will allow you to sustain in the long run, moving comfortably and doing the things you love. Well, we are your guide to getting on track with this simple habit-based approach to movement. In today's Wellness Connection video, we are talking about the importance of family involvement in your healthcare. I want to share a story about Dave and Linda, a great New England couple that came down here, and they noticed that Linda was having trouble with her balance. So much so that she would literally hold on to Dave every time she got up, and she really wouldn't want to walk and do much without him right by her side. Upon evaluation, which Dave and Linda were in the room together with me, I learned a lot about their story. How Linda loves to walk with her friend Paulette, how that they enjoy being able to go to Celtics games up in Boston and living an active lifestyle. Dave shared with me that Linda had some challenges with her memory, and that perhaps some of the fear and just kind of not having a good routine was actually more the cause of her being unsteady versus some sort of medical condition. So I learned Paulette's habits, the goals that they have as a couple, and then we built a great treatment plan. And let me tell you, Linda did awesome in physical therapy. She is walking great, balance is fantastic. They are leaving back for New England and getting back to walking with her best friend Paulette. So I couldn't have done this without both of their involvement. So we want to talk about why we encourage, when you come in for physical therapy, that we want either a spouse, partner, friend involved in the treatment plan, and we have nice spacious rooms, comfortable, and together as a team we can build the best plan and goals for you. According to the research of the Annals of Family Medicine, it is substantial the impact that the family can make to the involvement of the patient's well-being and health care and their success of their treatment plan. Since that time, which the study was published in 2005, great strides have been made to including a spouse, loved one, or partner in the role of your health care. So no longer do we want family members to sit idly in the waiting room, but rather to come in and to contribute, listen, and learn, and together develop a treatment plan that will ultimately help you have a better family and home environment. So physical therapy provides a unique opportunity for loved ones, friends, family to be involved in the individual, meaning the patient's care. So first, consider the roles of the therapist, the patient, and the family. So first, let's start with the therapist rather. So the therapist is the professional expert, the guide as we like to call it, to set up the treatment plan. First, determine what is going on, what are the deficits, what are the risk factors that would potentially cause challenges at home. It might be balance, it might be strength, it might be behavior and knowing what to do and what not to do, and setting up the goals, and then having one-on-one sessions with the therapist to work together in a safe and proper way at improving function. The role of the patient is to be engaged in the treatment. Of course, always patients that believe in the process and feel comfortable in the environment, they will do better. And to follow as you're here at the clinic, whatever it may be in terms of exercise, in terms of hands-on manipulation, or understanding their progress and working together as a team, therapist and patient. The role of the family is very important as well. For one, they can be in the treatment room, or we like to call it inner gym, observing, encouraging, and seeing the progress of their loved one in physical therapy sessions. But also they can provide a lot of encouragement, and here at Allied we like to dispense the myth that it's only the patient and the doctor, but family can be involved in the process, and of course we encourage it. Also at home, they can be a motivation or an encourager in making sure they do what is required of them at home, because yes, we see them 2-3 times a week, but there are many hours in between sessions where we want to be sure that the exercises and the behaviors that we have prescribed to the patient is being reinforced. Also, the family can kind of be a good objective kind of outside onlooker of the progress of the patient. For example, my wife, I think of her like I wear hearing aids, and when my hearing aids are starting to get old and they're not working right, the first person to notice is my wife. And once she indicates something's not quite right with your hearing, then I schedule an appointment with my audiologist and I get a new set of hearing aids or get them repaired. But the idea is sometimes in our own skin, we don't realize when we begin to kind of drift off course. We're getting more unsteady, or we're not doing the things that we used to do, or we're hesitant to go out and participate in social and family events. So again, the therapist has a unique, very important role of guiding the whole process. The patient, of course, has to be engaged and participating and being actively working on the things that we do in the sessions. And then, of course, at home, the family can also be very important with facilitating adherence to the program, encouraging the loved one in a positive way, and giving feedback at each session with the progress of the patient. So, advice for family members. First, be sure to ask if it's okay with your family member that you attend the physical therapy sessions or healthcare sessions with them. Also, be honest with them. Sometimes, as a patient in your own body, you may think either you can do more than you actually can, or you may think you can do less than you can actually can. So it's always helpful when you, as a family member, from the outside looking in, watching them, being with them from day to day, you can get a good sense of, are they not doing enough, or are they doing too much? And be sure to let the provider, the physical therapist, and even your family member kind of know what you see and what your perspective is in terms of their current activity level and what their potential is. That's always valuable information for the clinician. Or even what things did you used to do the patient used to do that you notice that they're not doing anymore. Also ask about restrictions. Is there some activities that you should not do or your loved one should not do? And then that way you can kind of help to make sure that you're not, your loved one is not overdoing it or putting themselves at risk. Also, it's important that you can help motivate and make sure that your loved one is compliant with their exercises, with activity levels, and you're encouraging them and also going along with them to make sure that they're performing the prescribed exercises or activities correctly. So remember, family participation in healthcare is a game changer. It can make such a difference for your loved one, even for yourself, because you will learn more things. And be sure to call us with any questions or send us an email, and we can clarify anything in terms of specific questions you have about being a part of the treatment process. So be sure to visit our YouTube page, subscribe if you haven't already. We're on social media, Facebook, Instagram, and also remember that we have our books available. I want to draw particular attention to this center book, which is the pelvic floor questions. Dr. Melissa Harkness, my wife, has written a great book on pelvic floor conditions. Be sure to download that, take a look at that. Also have ones on TMJ, knee pain, there are several other ones, and they're absolutely free on our website. So be sure to join us next time for our next Wellness Connection. Be sure to add some comments, share this with a friend, and thank you for making health your priority by watching this video.